Okay guys, Troy with Ohio Men's Health here. Today we're going to be talking about how to safely draw the injection for testosterone and have it prepared for us so then we can watch the second video, which is how to perform the injection. So first of all, we're going to need our supplies, okay? Bottle of testosterone, a syringe, this is what it will look like when it comes in your kit, and we're going to have two needles. We're going to have a pink one and an orange one. Pink is to draw, orange will be to inject, which we'll talk about shortly. And then some type of alcohol swab, whether it's cotton full of alcohol or an alcohol pad, which also comes with your kit. Now, the first things we're going to do when we get the testosterone out is we're going to go to the top of it. There's going to be a little plastic cap, which there's not on this one. You're going to pop that plastic cap off and you're going to see this little rubber stopper here. We're going to clean that. So the first thing we need to do is clean that with the alcohol. Okay, so we want to clean it with alcohol, but if you happen to touch it again, clean it again. We just don't want any bacteria on that. So we're going to clean that area. Then we're going to begin prepping our syringe and our needle to draw the medicine. Now the syringe, as you'll see, it'll come in a big plastic sleeve, and there's going to be two little flutes on the end here of this package, and this will be like this for the syringe and needle. So we're going to peel this apart and then pull the syringe out, and we're going to be very careful not to touch this end of the syringe, which is called the barrel. We don't want to contaminate with that with any bacteria from our fingers. Then likewise with the needle, we're going to use the pink one first, pink one to draw. There's going to be two fluted edges. We're going to go ahead and peel these back and peel this one back, and be careful not to touch that part of the needle called the hub. Okay, so this is called the hub. Now we're going to take the barrel, and you'll see it's got like little threads, like a screw. We're going to attach these together, screw them together, and now we have this complex together. Now, depending on your dose, we're going to go ahead and draw the medicine, okay? For instance here, I'm going to show and demonstrate how to get to 0.6. So you'll see a 60 with a line on here. And then on these syringes, you're going to see that the little plunger inside has two rings, a back ring and a front ring. We're going to be measuring off that front ring to the line at 0.6. So if that's my dose, I'm going to go ahead and put some air in of that amount. And I'm going to grab the testosterone now, being careful not to touch this rubber stopper on top, flip it over, pull this cap off, and then what we're going to do is just insert that into the vial, push the air into it, and then pull back slowly to where we get 0.6 or 60 on the syringe of testosterone into the syringe. Then what I'm going to do is I'm just going to drop this cap back on. Don't push it on, just drop it and then snap it, okay? Now we're going to need to switch needles. We don't want to use that needle to inject. That makes it so we can quickly draw the medicine in. Now we're going to go ahead and peel the flute back on our orange needle here and expose that hub. Spin the needle off the pink one and now attach the orange one. And now our syringe is ready, sterile and safe for the injection. Video number 2 will teach you how to do the injection. Video number 1 is all about teaching you how to draw the medication safely and sterilely. Along the way, if you were to touch anything at all, the hub, the barrel, the needle, just throw it away and use another one. We don't want any bacteria or contaminants on these items as we put them together and prepare them for the injection. And of course, if you have any questions, as always, just bring the medications in. We'll be happy to review. See you in video number 2, where we'll teach you how to inject the medicine.